It frustrates me to no end that every week and almost every day that I'm seeing patients come in with problems that are potentially curable, but they seek care too late and suffer long-term consequences. In this video, I'm going to talk about BPH, benign prostatic hyperplasia, also known as an enlarged prostate. So for those of you who don't know me, my name is John Lin. I'm a urologist here at Sunrise Urology in Gilbert, Arizona. Every single week, I'm doing surgeries on guys with enlarged prostates, seems like, and every single day I'm seeing guys with enlarged prostates. Most recently, a couple of guys came in with BPH, not surprisingly. One of these guys came in with a long history of urinary difficulties, and he came in because he had gone to the emergency room after he couldn't pee at all. He was completely stopped up. Now, this is one of the most distressing and uncomfortable situations that a guy can be in. Imagine that your bladder is full in your pelvic area, in your lower belly, and it's getting fuller and fuller, but you are unable to squeeze that urine out of the bladder. So for this gentleman, he let it go for so long that he was actually having urinary incontinence, meaning he was peeing on himself, having accidents before he finally went to the emergency room and sought care. So they got a scan on his belly and saw that his bladder is all the way up to the belly button and above. And when they put a catheter in, meaning they put a tube through the pee opening into the bladder to drain his bladder, they drained 1,600 cc's from his bladder. Now, normally bladder holds about 400 cc's. So this guy was holding on to a bladder volume greater than 4 times its normal ability, capability, capacity. Eventually, what happens when you stretch out the bladder so much, several things can happen. This gentleman, when he came in, he also came in with some x-ray studies. Somebody ordered in the ER a CT scan of the abdomen and pelvis. They noticed that his bladder was full, his prostate was enlarged, and there was back pressure, swelling up the ureters and into the kidneys. Ureters are the tubes that drain the kidneys. So when something like that is dilated or swollen, with the back pressure going all the way up to the kidneys, you start thinking, well, what could simultaneously block both ureters? Sometimes bad pelvic cancers can cause that. Maybe having stones in both ureters at the same time. But those are not seen on the scan, and they're less likely. So you should not be looking for zebras when something clearly obvious is in front of you, and that is an enlarged prostate. So this gentleman came in with a big prostate, couldn't void. He went into what's called urinary retention. They put a catheter in, drained his bladder, 1,600 cc's, and here he comes in. Thankfully, his labs, his blood work showed that his kidneys are still working properly. A couple of weeks ago, I saw a gentleman who went into acute renal failure, meaning his kidneys were shutting down because of a blocked prostate and a full bladder with back pressure going up within the kidneys. Over time, several things can happen. Luckily, it didn't happen to this gentleman. One thing, and this is, I think, is one of the worst things that can happen, is that the guy can go into chronic renal failure, meaning the kidneys are no longer working from this chronic back pressure from an enlarged prostate, distended bladder, going up into the kidneys. So those guys end up being on dialysis. Dialysis is something that you have to be attached to a machine 3 times a week for several hours a day at a time. So imagine your quality of life when you are on dialysis. It's terrible. In addition, the chances of you suffering some sort of complication or dying from dialysis within 5 years is not insignificant. So I jokingly tell my patients that my goal, whenever I see you, is to euphemistically get rid of you. Meaning I don't want to have to keep seeing you over and over. If that is happening, then I'm not doing something right, or you're not doing something right, or something is not going according to plan. My goal is to get rid of my patients, to cure my patients so they don't have to keep coming back. So this gentleman came in with the catheter. I did an exam on him. He definitely had a big prostate. So now he's going to have to undergo further evaluation. Most likely he's going to need to undergo surgery. Thankfully, his kidneys have not failed. Now, something else can happen with someone who's in urinary retention chronically. So that's example number one. Guy came in, distended bladder, wearing a catheter. He's probably going to need some sort of intervention. I started him on medication, and we'll see if that works. Medications are Band-Aids. I tell patients, medications are Band-Aids. I can look in the bladder today while you're on medication and look at it again after you've been on medication for 6 months, and the bladder and the prostate are still going to look the same. It may make you feel better when it comes to urination, but it doesn't cure you. So medications are Band-Aids. I started him on medication. I told him about all the side effects and how the medications work, and we'll see how he does. Now, something else that can happen with an enlarged prostate that you ignore for a long time is that the bladder, when it's overly stretched for a long time, many years, the bladder can give out. You see, the bladder is surrounded by muscle. That muscle is called detrusor muscle. When you stretch out the bladder, when you overwork the bladder ends up quitting on you, meaning you develop so much scarring, trabeculations, collagen buildup within the bladder wall that your bladder gets flaccid. I did a cystoscopy, or I looked inside the bladder of someone who came in just last week, and his bladder was flaccid, meaning when I looked in, there was no tone. That bladder is no longer able to squeeze, and he ends up having to put a catheter, a tube, into his bladder through the penis multiple times a day to empty his bladder, simulating voiding, meaning peeing on your own. So typically you're peeing about, on average, 7 times a day. So now he's having to self-catheterize 6 or 7 times a day just to empty his bladder for the rest of his life. The other option is maybe having to wear a catheter through the lower belly or through the urethra, through the penis, chronically, all the time. These are avoidable things. Kidney injury, bladder injury, so you have to wear a catheter or self-catheterize all the time. These are preventable things. I just wish I have the ability to reach out to people and say, please come in, get checked out, be cured of this problem before the bladder gives out, before the kidneys become injured. Sometimes patients can come in with bladder stones. The bladder stones form because they're not emptying their bladder. Sometimes the patients can come in with bladder infections because they're not emptying their bladder. Bacteria builds up, they drink, they don't empty their bladder. That stagnant urine is kind of like stagnant water in a pond. Bacteria grows, it stinks, it becomes infected, and the patients suffer. I wish that there's a way for me to just reach out there and convince people that the workup is very easy. There are many treatment options, and the treatments are extremely effective and durable, meaning it lasts. Typically, by the time the guy comes in, if he's in his 60s and 70s, I tell these guys that if I were to do this surgery on you, most likely the results will last the rest of your life, meaning you no longer have to come in to see me anymore for this problem. Again, my goal is to cure my patients, to euphemistically get rid of my patients so I don't have to keep seeing them over and over again. If you know someone with an enlarged prostate, someone who has to go to the bathroom a lot, someone who has to strain to urinate, someone who gets up at night multiple times, someone who seems like he has to go to the bathroom every time before you go out, knows where all the bathrooms are, seek care before something bad happens to your bladder. As always, I welcome any comments or questions in the comment section below. Thank you so much for watching. Thank you for the privilege of your time. Please take care of yourself and take care of each other. Bye-bye.